What is the closest to death I've ever seen a patient come without actually dying? I'm an emergency doctor, and this has happened multiple times throughout my career, but this one really sticks out in my brain. I was pretty fresh out of residency. I was a new doctor, and I heard nurse to triage. And later on, I found out one of the older nurses went out there by himself, and a grandson and his grandfather pull up in the car, and the grandfather is so weak, really so lifeless, that when the nurse opened the door to help him out, he almost fell all the way out. I mean, fortunately, he had his seatbelt on because he slumped over, and the nurse was able to catch him and release his seatbelt and slowly get him into the wheelchair. But once they got him into the emergency department, after my 11 years of training to be a doctor, the most important thing I could do in that moment, as this limp, lifeless person is in the wheelchair, moving rapidly towards one of our resuscitation bays, is my job is to just hold his head up. Because this guy's head is just so limp, it's falling over to the side, and he's about to hit the wall and get like a cervical spine fracture or something like that. So I'm like running backwards and holding this guy's head in the center as we get into the resuscitation bay. And at this point, pretty much everybody in the ER that works in the ER is in that room to help this human being to make sure that they don't die. We put him up on the bed. His oxygen levels are low. His blood pressure is low. His heart rate is high. We start to assess what this cause is. There are multiple things that can cause this, but one of them is really kind of at the top of my differential already. And then one of the nurses comes around the corner and says, "That's the guy we put a chest tube in last week." And when you put a chest tube in somebody, usually they have something called a pneumothorax or like a hemothorax. And that's basically, with a pneumothorax, is when there's air. It's outside of the lung, but inside of the chest cavity. That area there, that's called the pleural space, that's supposed to have a negative pressure in it. And that negative pressure, that kind of like vacuum, can hold the lung up and out and expand it, basically. And then once that negative pressure environment has extra air in it, extra pressure in there, it can become a positive pressure environment. And that's bad, because then the lung collapses, basically. So a pneumothorax is a collapsed lung. But if there's something where air is continuously leaking into that pleural space, then the pressure increases on the lung, and it pushes the lung, collapses it more and more and more, and can end up putting so much pressure that it actually can collapse the veins as well that are leading blood back to the heart. And if you can't get blood back to the heart can't pump blood out to the body, and that is a rapid pathway to death. And so I listened to this guy's lungs with my stethoscope, and I could not hear breath sounds on one side. That's the side where he had the chest tube. I could see where he had the incision the week before. I knew what this guy had. It was a tension pneumothorax. So I grabbed a scalpel. There wasn't any time to get an actual like chest tube tray and get all the different instruments out that I needed. And I just took the scalpel and I cut down the fifth intercostal space in his ribs, the mid-axillary line. Your axilla is your armpit, and I cut down to the muscle layer. And at that point, usually you get these other instruments to push through the muscle layer to release all that pressure that's in there, collapsing the lungs and collapsing the veins. But there wasn't enough time, and so I just cut down to the muscle layer, and I did something called a simple thoracostomy, a finger thoracostomy. I took my finger, I put it inside that guy's chest, and I pushed as hard as I could until I pushed all the way through this guy's muscle layer. So I'm basically impaling this human being with my finger, but the minute that I did that, I pulled my finger to the side, and air just started rushing out, just I could feel it on my finger. You could hear it. The whole room is like, "Oh my God!" And you turn that positive pressure environment outside of the lung into a negative pressure environment once more when you stick a tube in there and you put it to vacuum, basically to suction, and then you pull all that air out. The lung re-expands. You watch the person's oxygen levels come up. You watch their blood pressure come up. You watch their heart rate come down to a normal level. And a couple minutes later, the guy's like complaining about how much his chest hurt, and we all knew why. And that was a great thing. That was a wonderful thing that he was feeling his chest and he was complaining about his chest, because we saved the man's life. Fuck yeah, I love emergency medicine.